Hi, my name is Lindsay, and today I'm going to be going over my DNP scholarly project, which is ketamine for treatment-resistant depression. My committee members are Dr. Elizabeth Buck, PhD, RN, Dr. Rachel Citron, and Janice Hughes, CRNA, nurse practitioner. Ketamine was first introduced in the 1960s for anesthesia purposes, but has started to emerge as a treatment for depression. The use of ketamine is typically used in surgery for general anesthesia and short-term medical procedures and is safe for both adults and children. However, researchers are finding that there are other uses for ketamine, such as the treatment of mental health disorders such as anxiety and depression. There is an increased interest in the ketamine use because of its rapid antidepressant properties that can be obtained right after administration. While depression is a leading cause of mental health disabilities and suicide risk can increase if left untreated. My interest in the use of ketamine grew after working in a ketamine clinic and seeing patients come back after their first dose of ketamine, stating that they felt better and saw that their depressive symptoms have subsided tremendously. The use of the Beck Depression Inventory (BDI) score or tool was used to compare the scores before the initial dose of ketamine and again at the end of their final treatment of ketamine. Most of those scores after the use of ketamine were very greatly decreased. We were to identify the patients with depressive symptoms that weren't really being managed by antidepressants that well, which we call treatment-resistant depression. And the goal was to develop a quality improvement project to help manage those depressive symptoms effectively and improve patient outcomes. Ketamine is significant to advanced practice nurses because they will have the resources and ability to provide a different pathway to help patients with anxiety and depression. They have the ability to treat patients who do not want to take daily antidepressants or aren't seeing the results that they once were with those medications. The use of ketamine would be highly effective in the nursing community to help patients experiencing acute symptoms of depression and anxiety and those with suicidal ideations. Having access to ketamine that can rapidly relieve symptoms helps nurses care for the patient and manage the situation more quickly. The review of literature included Ovid synthesis as well as the Merivale Advanced Discovery search features. The first search strategy was using Ovid synthesis to retrieve primary research articles. The search parameters applied to narrow the search were randomized controlled studies in the years from 2017 to 2024. Keywords included were depression, ketamine, and mental health. There were over 260 articles in that initial search. The search was then narrowed using and or to combine words, ketamine, treatment resistance, and depression, which again resulted in over 260 results. The second strategy used was the Merivale Advanced Discovery search feature. The parameters for this included peer-reviewed English language and year-to-year literature review from 2017 to 2024. The keywords were the same as those used in Ovid synthesis. This initial search resulted in 614 articles, which were then again narrowed using keywords such as and or. Antidepressant, IV ketamine, Beck depression tool. This resulted in 82 articles. The abstract for our articles were read and then chosen based off which one pertained to the scholarly project, which was able to be narrowed down to 12 articles to help support the use of ketamine in the treatment of resistant depression in men and women ages 18 to 70. The Lewin's force field analysis was used for theoretical framework. The first concept is the unfreezing process. This means we are motivated to change by new ideas and create a shared vision of patient care and outcomes that could be enhanced by change. This project is referring to patients with depression who are currently on antidepressant medications, but no longer seeing results or decreased depression symptoms. These people are now defined as treatment resistant and are looking for an alternative to help them with their depressive symptoms. Along with change comes internal and external factors that impact depression. The second concept of the theoretical model is the changing, and there's a new perspective that life will not be the same. This is where the implementation of ketamine infusions begin. Patients will begin by completing the Beck Depression Inventory and then beginning their ketamine infusions. At the end of the final ketamine treatment, the patient will again take the Beck Depression Inventory tool. The results from the initial inventory tool will be compared to the final inventory taken. The third concept of the Lewin's model of change is the refreezing process. This concept describes how the patient integrates the new practice and behavior and uses it in their daily life. This step is a patient's new life with the use of ketamine after their treatments up to 6 and their depressive symptoms should remain low. They can return to their more daily activities and have less depressive symptoms. The design of this quality improvement project was a quantitative design through retrospective chart review. Patients were not recruited, and approval was given by the facility owner. Participants' charts from the Scottsdale Ketamine Clinic will be chosen at random by the researcher, by myself, and they can either be female, male, or non-binary, and between the ages of 18 and 65. The participants will fill out the Beck Depression Inventory, which is a 21-item self-rated scale that evaluates symptoms of the depression. Scores range from 0 to 63, and screen patients scoring over 20 or higher would be considered an appropriate candidate to receive ketamine treatment. There will be a written list of all the patients that are approved, and this written list will be with the owner and will be given to me to review only while I'm at the clinic. At the completion of the data completion, the list was returned to the manager, and the data was recorded into the data sheet to complete the goals of the project. The data collection process was stopped when I had reviewed over 50 charts based off the written list. For a participant to be included in the quality improvement project, the participant must be 18 to 65 years old, and they must score a 20 or more on the Beck Depression Inventory tool. Exclusion criteria included: if a patient is under 18 years old, then no data will be collected. If a patient is over 65, then no data will be collected. And if the score is below 20 on the Beck Depression Inventory Scale, then no data will be collected either. This quantitative design was meant to answer the PICO question: does the use of ketamine help reduce the symptoms of depression for those individuals who have not been successful with traditional antidepressants or those with treatment-resistant depression? To help with the data analysis, the Beck Depression Inventory tool was used. The process of collecting data consists of the pre-analysis, analysis, and interpretive phase. In the pre-analysis phase, the data is reviewed to make sure it is complete with no missing data, such as a missing screening tool that needs to be completed by the patient. The analysis phase is to review all data, numbers assigned and put into the data collection sheet. The interpretive phase will be to see if the scores on the Beck Depression Inventory score were less after the patient's ketamine infusions. The statistical program that was used for the data analysis was the nominal, independent, and dependent variables. The chi-square test was used to analyze group differences when a dependent variable is measured at a nominal level. And the advantages are its robustness with respect to distribution of the data, easy computation, and detailed information. This quality improvement research study determined the effectiveness of the use of ketamine for depressive symptoms. There is statistical evidence between the pre and post inventory interventions that show that ketamine helped lower depression scores through the Beck Depression Inventory tool. The Wilcoxon test indicated improvement and was statistically significant, with Z equaling negative 6.733 and the P equaling less than 0.001. Based on the research findings from data collection, there is a strong evidence of clinical significance that ketamine can help lower depression symptoms and should be considered by providers as a treatment option for those suffering with depression that are not managed by their everyday antidepressant medications. This quality improvement project had some limitations and barriers to completion. And they were related to data collection and sample size. The sample size was small at only 61 charts that were reviewed because the Beck's Depression Inventory tool was not completed by some patients before the first dose of ketamine, and some participants did not complete all the ketamine infusions, and others did not fill out the post Beck's Depression Inventory tool. Patients were screened for depression before the first dose of ketamine. However, patients might not be in the right frame of mind to complete the screening tool due to its length and cognitive deficits. Depression screening data that could be missing from the data on patients who did not score high enough to receive ketamine treatments, which results in some of the data being inaccurate. There was a time limit for completing the project and sustainability. This quality improvement focuses on sustainability. The results of this quality improvement project depended on validity and reliability of the measuring tool. The Beck's Depression Inventory tool, BDI, is one of the most widely used measures tool for assessing depression. There's been many studies that have shown consistency through the reliability testing, and validity has been shown to be consistent for detecting depression with the BDI. The positive results were presented by showing the post-Beck's Depression Inventory tool that showed the lower points, which means that ketamine was helping to reduce depressive symptoms. Intervention was consistent with guidelines, and this was a cost-effective intervention. There was support from the clinical site and the clinical site owner. Sustainability, the Beck Depression Inventory tool was reviewed on a timely fashion to ensure the results of ketamine treatments were beneficial to decrease depressive symptoms. And this quality improvement project suggests that ketamine use is expected to be sustained. More education can be provided to staff and patients to ensure they understand the importance of administering the BDI before and after treatment, and to provide more information about ketamine so the benefits are more easily understood. Minimizing limitations and implementing a new process can meet resistance from all staff members. So overcoming this limitation was essential for the project's success. Scheduled meetings were held to further explain the importance of the needed change and to provide education and answer questions. There was constant communication, so there was no further barriers to the process change. The quality improvement facilitators were the driving force of this project. Identifying and screening are among the most critical steps in assessing the depressive symptoms with a reliable and valid tool. Another facilitator is having access to patient charts and given the provided list of patients who had completed the BDI before and after ketamine use. The implications for continued practice with the use of ketamine showed through the Beck's depression inventory tool that ketamine does help to reduce depressive symptoms just even after one dose. Other clinics and healthcare institutions should consider offering ketamine treatments as an alternative medication. Screening for depression symptoms and all the use of ketamine requires interpersonal collaboration between the patient's primary care physicians and mental health providers. Collaboration among patients and providers is important for decision making, ensuring that the patient's mental health needs are met. Screening for depression allows for proper diagnosis, treatment planning, and medications provided. This design process included collecting quantitative data from de-identified charts in the paper charting system during both the pre and post intervention. The statistical data showed that the results of the Beck's depression inventory tool before the use and after the use of ketamine was successful in reducing the depressive symptoms. The Beck depression inventory tool provided reliable and valid results. With positive results, this protocol should be added to the treatment of care to continue the impact it has with change and sustainability. This quality improvement project has shown the benefits of ketamine treatment to help reduce depressive symptoms in those who are treatment resistant. The project showed great validity and reliability, and positive symptoms were observed after the start of the project. And with the help of and based off the research findings, there is strong evidence of clinical significance that ketamine can help lower depressive symptoms. Thank you for your time and listening to this presentation.